My name is Nancy Bedingfield. I'm a first-year PhD student in the Faculty of Community Health Sciences at the University of Calgary. My PhD research will happen within a larger research project called AVENA. AVENA stands for Enhancing HPV Immunization with First Nations in Alberta. I am also a public health nurse. I've been a public health nurse for 15 years. For most of my career, I've been lucky to work with newcomers to Canada. I am looking forward to building new relationships with Indigenous communities in Alberta. And because this is a new experience for me, I am glad that my research is happening in a team made up of multiple partnerships. These are the organizations that have members working in the AVENA team. A very important partner is the Alberta First Nations Information Governance Centre, who is helping to build relationships between our research team and Indigenous communities. And the logo at the center is the Alberta First Nations Information Governance Centre logo. There have been two important opportunities for our research team to meet with community members. The first was in November 2015 during the grant writing process. We met with elders from 3 Southern Alberta First Nations to discuss the research project, listen to feedback, and learn more about the impact of cervical cancer in their communities. The second was a larger gathering which occurred just 3 weeks ago. Leaders from the Tsuut'ina Nation joined our research team in hosting elders, health directors, and community members from 12 Alberta nations. Information was shared about HPV, cervical cancer, health services, communities, and culture. As you can see, building relationships is a slow process. This is slow because there is a history of mistrust. Past research has been done to rather than done with Indigenous communities in Canada. In order to build trust, health research done with Indigenous communities must follow the 4 R's. The 4 R's are reciprocity, relationality, rights and regulations, and respectful representation. These 4 principles ensure that communities will benefit from the research that is done with them, research will be built on trust, cultural protocol will be followed, and descriptions of communities will be respectful. There are 2 important documents that guide researchers in this work. The first is Chapter 9 of the Tri-Council Policy Statement, which focuses primarily on research agreements. The second is OCAP, which explains that communities own, control, and possess the data that is generated in research with them. So where am I in this process? I have not yet consulted with communities about my individual research because engagement with the larger research project is still developing. Once I am able to start building my own research relationships, I can consult and my research ideas can become more definite. So let me tell you more about my research ideas. First, it is important to know about human papillomavirus, or HPV. HPV is a very common sexually transmitted infection. Persistent infection with HPV can lead to many diseases, and one that you have most likely heard about is cervical cancer. Unfortunately, Indigenous women experience higher rates of cervical cancer and more severe cervical cancer than non-Indigenous women in Canada. Though little research has been done, it is suspected that Indigenous children are immunized against HPV at a lower rate than non-Indigenous children in Canada. In Alberta, all children are offered HPV immunization in grade 5. Usually this immunization is given in the school. Previous research has found that school-based immunization is great for convenience, but makes it harder for nurses to educate parents about diseases related to HPV and to answer questions about immunization. There has been no published research done in Canada on HPV immunization with Indigenous peoples, but we can learn from research done in the United States and research on other vaccines which has been done in Canada and Australia. There are many important issues raised in these studies, but one very strong theme is the need to explain immunization and to raise awareness about the diseases prevented by immunization. It's very important that this education is empowering and rooted in local culture. However, there is a lack of specific instruction in this literature on what these education initiatives should look like. And this is appropriate because many of these details depend on community context. We can learn more about community context through the social determinants of health. However, for this research, it must be an Indigenous way of understanding the social determinants. For my research, I hope to use a framework for the social determinants developed by the Assembly of First Nations. This framework is different because it has community at the center, discusses spirituality, and focuses on connections. And this leads me to my research question, which is, what is community context for education to support HPV immunization in terms of cultural continuity and self-determination in each of 3 participating unreserved communities? Because the unit of analysis in my research is the community, it is essential that community strengths are the main focus. Therefore, I will be guided by, but not follow explicitly, a research methodology called appreciative inquiry. This method focuses on discovering strengths and moving towards goals. The methodology I will use for my research is multiple case studies. I will collect data through qualitative interviews with local leaders in healthcare, elders, and parents in each community. The knowledge generated in this research will be used by Avina to develop interventions tailored to each community. So I'd like to leave you with the 2 main messages that make my research different than other examples of patient engagement research. First, communities create the conditions for health through a network of connections that produce culture. It is important to consider that communities can also be patients. Second, there is an ethical obligation to ensure that patients benefit from health research. This obligation is even more acute in Indigenous communities. Because there are different ways of seeing the world, this requires community members to have a voice in planning research, and therefore, ethics demands engagement. That's it. Thank you very much.